Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology here in Portland, Oregon, and I'm coming to you today with another segment. Not our typical question and answer session, but an original that I want to talk to you about because I've had a number of patients come in, specifically with recurrent urinary tract infections or recurrent urinary tract infection symptoms. And when we go through our workup and we decide that the patient is having recurrent infections or they're having recurrent infection symptoms in absence of infection, we oftentimes recommend what we call instillations, or what I like to call bladder cocktails. Now, what that is, lots of times when patients have recurrent urinary tract infections or they have the symptoms when the culture is actually not positive for an infection, it actually means that your bladder is inflamed. And when a tissue becomes inflamed, it becomes more susceptible to further irritation, which creates a vicious cycle. And when that happens in the bladder, it becomes more susceptible to bacteria causing infections, viral etiologies. It can also, the bladder can develop the irritability where you have to go frequently and urgently and you have burning. So what we like to try to do is settle down that inflammatory process. And lots of times when we settle down the inflammatory process, we notice the symptoms go away. The bladder is able to heal itself. We can kickstart it into healing and the patient feels much better. So, what are these bladder cocktails? Well, again, they are a special mixture of solution that we mix up in the office. They can be a variety of different things. We have a standard solution that we use in the office. We also have prescriptions of things that we can have the patient pick up, such as DMSO or silver nitrate. In the office, we can mix up Kenalog or a heparin solution, depending on what your particular situation happens to be. We can mix up one of these different bladder cocktails and we give the bladder a little drink. We put the catheter, a very teeny tiny catheter, into the bladder. We drain the bladder of all the urine and we inject this solution into the bladder, and what that does is it helps to coat the lining of the bladder so that the bladder can heal. And we tell the patient to hold this in their bladder for an hour or perhaps 2 hours, depending on the solution. And then the patient can void that out normally. And we usually do this starting out in a series of 6 because we've found that a series of 6 really allows the bladder to really start healing the way it should. Now, I particularly tell my patients it takes 3 to 4 of these bladder cocktails to really start noticing benefit. So be patient. These symptoms didn't start generally overnight, they develop over time, and when the bladder becomes so inflamed, it takes usually a few weeks to help that bladder settle down. So what are these instillations or these bladder cocktails? It's a way for us to help you help heal the lining of the bladder so you can get back to living your best life. So hope this helps. Hope it gives you a different avenue for treatment. If your doctor is not already using this avenue, perhaps you might want to suggest something like that to help the doctor become creative with treatments that might work better for you. I know we really like to try to find creative ways around here to help everybody out. So, without belaboring the topic, I hope this helps. And as always, let 360 Pelvic Health help restore your confidence.